Good morning. It's 9:30. Today is Saturday, September 26, 2020. Today is our scheduled yoga therapy class through Somatic Space Yoga and Healing Studio. Today's topic is very important, is yoga therapy with somatic movement. Somatic stands for your body. So it is a yoga therapy through the movement of your body. And this is the basis of yoga therapy in West. Remember, in the West, the beginning of the practice of yoga is with the asana. Asana practice, the poses. When you go back to the birthplace of yoga in India, you will see the beginning of the yoga therapy will start with your philosophy of the yoga, first two limbs, yam, the social restraint, niyam, the personal restraint, then they will move forward. So, what is the basic physiology behind it? As you know, the yoga therapy is primarily targeted for the lifestyle-related disorders or lifestyle-related diseases. And yoga therapy is called as a lifestyle medicine. And the basic underlying pathology is called the stress, activation of sympathetic tone, a release of the hormone called cortisol, creating truncal obesity, and a cascade of phenomena which is called metabolic syndrome. Yoga as a therapy, which is the adaptation of the yoga practices for different clinical condition, the outcome is a relaxation response and activation of parasympathetic tone. So yoga therapy with the somatic movement, basically activation of relaxation response. Now, when you go back or when you trace the term relaxation response, this term was introduced by Dr. Herbert Benson. And Dr. Herbert Benson first started a practice of yoga through transcendental meditation of Maharishi Mahesh Yogi. This is around 1967 to 69. And they have a big center now in Iowa. It's called Fairfield, Iowa. But they changed the name of the city. The city is called Vedic City. When, as a physician, he was exposed to the transcendental meditation, he noticed the changes in the body physiology. Lowering of the heart rate, lowering of the blood pressure, the respiratory rate, blood oxygenation level, basic metabolic rate, oxygen consumption, and he wrote a book called Relaxation Response. But if you read the book, go back and look at it at that time, it clearly shows that relaxation response is nothing but meditation. Probably, we don't know. He's still here, he's still with us, he's still in Harvard, he's in charge of the whole center called Benson Henry Center. But looks like that he was not comfortable to use the word meditation at the time in the United States and use the word relaxation response. And we all know from our basic physiological study that meditation is the state when you have all the physiological changes, and we use the term called meditation is medication. So let's look at how we do a practice of relaxation response from the physical body, which is called somatic movement. You have to appreciate, you have to feel the effect of the movement of the body, and will be able to stay in the pose. So let's first start a little discussion, for the discussion's sake, before we start the practice. For discussion's sake, we'll do, and the practices will do, first practices will do, that to bring that relaxation response, or we call the activation of relaxation response, what are the steps or stages we go through. We're able to sit down in a asana pose, either in a chair, I have a chair in the back, chair in the front. It's called, in Sanskrit, Sthiram Sukham Asanam. Sthiram means stillness, Sukham means happy, asana is a pose. Then we hold into that pose. When you hold into the pose, you go through different stages of the asana pose. First is the beginning. In Sanskrit called arambho. The muscle contracts, ligament tightens up, you get into pose, like we're doing a spinal twist. You get into a spinal twist. You stay in the pose with your breathing, effortless breathing. And the main breathing is exhalation longer than inhalation. Lung is like a balloon. It has a 4.5 liter capacity called vital capacity. We only breathe 0.5 liter vital capacity. So learn how to breathe out all the carbon dioxide, bring more oxygen in, then remove more carbon dioxide. And also exhalation is parasympathetic, inhalation is sympathetic. Learn how to control our five senses. Hearing, we see, we smell, taste and touch. By closing our eyes. When you start closing your eyes, you enter into the fifth step, it's called pratyahara. Pratyahara. Pratya is reject, ahara is the intake. Fourth limb is called a pranayama. Pranayam. Yam is control, restrain. You control, restrain your life force called prana. And that is also done through called voluntary regulated breathing. We have the whole session on pranayama. You can look at my YouTube videos and they're all there. Then my brain is in a state of vibration and we create a vibration. We create a vibration called A, U, Ma. A from lower part of the lung, U from the middle part of the lung, Ma from the upper part of the lung. Or we create a vibration like called a bumblebee breathing, called Brahmri Pranayam. Both the frequency has the same frequency as the brain. It's called physics, called harmonic resonance. That cancels and quiets down your mind. Then you slowly start doing it's called pumping and cupping, which stimulates the branches of the vagus nerve through the massaging of the ear with a constriction of your pharyngeal sphincter, constriction of the laryngeal sphincter, stimulating the branches of the vagus nerve, able to hold your breath like a breath holding in inhalation, and it brings a profound relaxation response. Then we'll look at the asanas, the poses, which creates profound relaxation response. We'll start with the sitting asanas, then we'll say first the thunderbolt called Vajrasana. Vajrasana is a primarily activation of the relaxation response. And Shashanka asana. Shashanka asana is a rabbit pose or a moon pose. Then we'll be holding our breath with a spinal twist. Like a spinal twist called Vakrasana, Ardha Matsyendrasana. Standing pose will show you the standing, able to hold the pose for a longer and longer time, which is called stimulation followed by relaxation. We'll do some face down poses. We'll see how to activate relaxation response, and we'll also do the laying down supine poses. We've got a supine and a prone poses, and we'll finish with that. So, let's first start with your steps to bring relaxation in your body and mind, and what are the other components before you go to somatic movement. If you're sitting in the ground, you can sit down in a called an easy pose, or you can sit down in a chair. If you sit in a chair, or if you sit in a ground, you sit in a ground with your feet underneath your knees and keep your spine straight. Same thing, if you're sitting in a chair, be sure keep your spine straight. And always show it to you. When you sit in a chair, you should sit down with your spine straight. If you sit in the front, you should keep your spine straight. Your body will look like a 90-degree angle. If you sit all the way to the back, your spine is straight. You're always your spine straight. When you keep your spine straight, the muscles next to your spine, which are called paraspinal muscles, the muscles relaxes. Normally, my skeleton is going to fall in the front. So the paraspinal muscles contracts to keeps me up in upright posture. They're always in a state of contraction, tightness. The moment you keep your spine straight, you give a little relaxation to the paraspinal muscles. And your relaxation response starts to set in. So, if you sit in a chair, do it in a chair. I can sit down in the ground. So let me start sitting in a ground. And you will see in a relaxation response, you enter slowly and slowly into different stages of asanas. This is Sukhasana, easy pose. Put your feet underneath your knees, cross in the middle, keep your spine straight. Then use your hand mudra, called hand gesture. Remember, hand is a connector between your body and mind. Anything happens to your mind, before you can speak, it shows in your hand. For example, you like something, you show this before you say I like it. Or if you want something, you'll put your hand before you say I want it. If you're listening to somebody, you touch your fingers like this, it's called a Hakini mudra. This is shows your focus of your mind, concentration. A lot of other mudras, I always have a whole section on the mudras. It's called Shankha mudra. It's called a Dhenu mudra. But in the hand mudras are very important. But touching index finger and thumb, this is your Dhanu mudra or Jnana mudra. One very important concept in relaxation response is that you need to use the power of your breath. The lung has 3 segments: lower lobe, middle lobe, and upper lobe. Whenever you do a your normal breathing, it only fills up your lower lobe. When you do the active breathing, when you learn how to do it effortlessly, you fill up your middle lobe. Finally, you fill up your upper lobe. Use a vibration with the and a mudra. And we'll do it, which is called a pranabha pranayama. So same mudra, touching index finger of thumb, when you put your thumb up, it's called dhanu mudra or ganu mudra. If you put your hands down, this is called your chin mudra. It opens the lower part of your lung. If you bend other fingers, this is called chinmay mudra. It opens your middle part of the lung. Then if you take your thumb inside and close, this is called balo mushti mudra. Balo means baby, baby fist, or called adhi mudra. It opens the upper part of the lung. When all the three parts of the lung opens up, you take a deep breath, filling up lower part, middle part of the upper part, which is called three-stage breathing, which is called your dirgha shwash. Dirgha means long, shwash means your breathing. That's the basis of the relaxation response. So here we are. Now we touch the index finger and thumb, put it gently over the knees, and then you close your eyes. The moment you close your eyes, you are literally controlling your five senses, because the vision is very powerful of all the five senses: hearing, smell, taste, and touch. Eyes are a direct connection with your brain, because if you look at a retina, back of your eye, connects with the optic nerve, which is a very powerful big nerve, and it connects directly to the brain. And there are two other called cranial nerves. Nerves coming from the brain supplies your eyes. The different muscles in the eyes, we call it SO4, LR6. SO4 means there is a muscle in the eye called superior oblique, which is supplied by the fourth cranial nerve, and LR6 means called lateral rectus muscle, another muscle supplied by the sixth cranial nerve. Able to close your eyes, it quiets down your mind. Bring your awareness to your breath. Visualize your breath. Then think about what your lung looks like. Lung is like a balloon. It has 6 liter capacity. It needs 1.5 liter of your gases to keep it open, because it's a balloon. Then it has a 4.5 liter of air which we are able to exchange. That's called a vital capacity. It's called inspiratory reserve volume, expiratory capacity, and the normal volume called a tidal volume, which is only 500 cc or 0.5 liter. So you will learn how to breathe out first, then take a slow, deep breath without any effort, and breathe out longer than breathing in. Slowly and slowly, you will increase the number, like you will count of 2 in, 2 seconds in, 4 seconds out, which will be very easy to do. And when you get more and more progressive, with a 3 seconds in, 6 seconds out, 5 seconds in, 10 seconds out, we can do 8 seconds in, 16 seconds out, even 10 seconds in, 20 seconds out. The moment you keep on increasing slowly and slowly, more and more oxygen comes in, carbon dioxide gets all removed from your body, which is really a toxin, and you create the relaxation response. So let's start with our next phase. I'm already feeling relaxed. So let me progress to the next asana, which is changing the foot. Now you change the foot or changing the leg and stay in the same Sukhasana. Now what I have done before, my left leg was above your right. Now I'm changing my right is above my left. And when the relaxation response sets in, I can feel it. I can feel it. My body almost starts to become fluid. So I breathe out first. Slowly I'll breathe in, count of 2 in and count of 4 out. If you're doing with me, please practice with me, but do not progress when you develop any effort in your breathing. Count of 2 in, 1 and 2 in. Count of 4 out. 1 and the 2 and the 3 and the 4 out. It's a very nice relaxation response. Exhalation is parasympathetic, inhalation is sympathetic. Let's progress. I can do it for a little longer and longer time. Let me do it count of 4 in and count of 8 out. It was still very easy for me because I have been practicing every single day. So let me go to count of 6 in, count of 12 out. Wonderful practice. I started having some saliva in my mouth. It means I'm developing some parasympathetic activation. Let me start, see if we can get a count of 8 in, count of 16 out. Wonderful practice. You can feel the somatic movement. Body movement is coming. Body is relaxing. And we're going to do a little bit of a movement. You will see the movement will be going in stages. Beginning, it's called arambha. Muscle contracted, it prevails. I'm relaxed. Now, I go to the next. It's called a siddhasana. I take the heel all the way to the back. I take the foot in the top. My knee drops down. I don't push it down. If you push it down, come back higher. With the relaxation, it will go on its own. This movement, the changes is happening in my body. I can feel it. It's a little stimulation, followed by relaxation. I can increase the relaxation by creating a vibration. One vibration is called a bumblebee breathing, Brahmi Pranayama. We shut down our five senses, create a vibration which has the same frequency as the brain, and it brings a relaxation. This is a stimulation, able to sit down in a perfect pose or a siddhasana, and Brahmi Pranayama will be your relaxation. Shut down our five senses, put your index finger in the third eye, 3 fingers to close your eyes, and thumb to close your ear. You can also do it with a Shanmukhi Mudra by putting the 2 fingers all the way down here. But this looks very comfortable. I'll be breathing out first, breathe in through the nostril, and breathe out with the sound of a bumblebee. I'll do 2 times. See if you can do with me and continue. I'll do 2 to 3 times. Get into pumping and cupping. Take both the hands. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hands, if you're wearing glasses, remove your glasses. Take the hands like a cup. Put it over your eyes. Let the eyes take all the heat. Then massage your forehead. Massage your eyes. Massage your face. And then the ear. Behind the ear. Front of the ear. Tragus, the front to front, external ear canal, that is called auricular branch of the vagus nerve, parasympathetic activation. Bring your hands, massage the carotid sinus. This also activates your parasympathetic tone. Stimulation and relaxation. Remember, we have the body types, Vata, Pitta and Kapha. Kapha is stimulation, Pitta and Vata is relaxation. So stimulation and relaxation of the body is your somatic movement. Now, I'm also very comfortable. Now what should I do? See, I go to the next stage. Next is your called Ardha Padmasana. Put my feet high up here, or also called Swastika Asana. And there should be no pain. Remember, the beginning of the asana practice, especially somatic movement, is no pain. Because if you have a pain, it's going to wake you up. It is not going to give you the feeling of relaxation. If it is hurting you, bothering you, you can always take it a little bit back. Start where there is no pain. But if a little discomfort, we call it a comfortable discomfort. So another way, activating all the 3 segments of the lung, which is called your Pranabho Pranayama. Pranabho Pranayama is A from the lower part of the lung, U from the middle part of the lung, Ma comes from the upper part of the lung. You will see we'll be doing the same practice when you're laying down. We'll be doing called a deep relaxation. When you do relax in the lower part of the body, we'll do it ah. When you do the middle part of the body, we'll do the woo. Upper part of the body, we'll do the ma. And with the different mudras, this is called your chin mudra. Touching index finger and thumb, put it over your knees. Always breathe through your nostril, because when you breathe through your nose, the air comes in, air gets filtered. Nose is like air conditioner. If outside air is warm, it will cool it down. And outside air is cold, it will warm it up. It goes to both the sides of your nostril called turbinates, and the air goes into larynx, trachea, and into the lung. So all the air goes into the lung. If you breathe through your mouth, you don't know where the air has gone. Partially can go to your stomach or to the lung. If you're practicing with me, you can practice now. It will be ah, lower part of the lung. All will be through your nostril. You breathe out first. Deep breath in. Chinmay mudra, fold other fingers. Ooh. Adhi mudra, ma. You clearly feel the activation of the relaxation response. Primary sign, saliva in your mouth. When you get a saliva in your mouth, your parasympathetic activation is taking place. Balance it. To the other side, now your right foot comes into the top and right knee comes down. Urdhva Padmasana, half lotus. And you are feeling the every movement. See, we're going very slowly and slowly. So go from called beginning, the arambha, is a Sanskrit word. Then is a sthiti. That when the muscle starts to relax, before it starts little twitching, it's called fasciculation. The fasciculation is gone, you feel a relaxation of the muscles. Finally enter into state, you enter into a state called profound relaxation. It's called Visarjana. In a profound relaxation, you feel the somatic movement, the movement of your body. And here, now we can get the other foot high up, and I can sit down in a called a lotus pose. This lotus pose is bringing the relaxation response. Now from here, what I will do, I will start scanning my body. I'm closing my eyes and I'm looking at my subtle body. What is the subtle body? Gross body is connected to your body, subtle body connected to your mind, causal body connected to your spirit. Subtle body is the body of your mind. That means I've been looking at my body for all my life, and my brain has a imprinted signal of my body. I don't need to see my body. Closing my eyes, I can see every part of my body, and I can slowly and slowly create a stimulation and relaxation of my body. The proof is already there. Like if I look at somebody's face, area of my brain gets active. I keep on looking, I keep on looking, I keep on looking at the face, I develop a memory. It's called a neuroplasticity. My brain gets an imprinted memory. Now, if you do a brain scan, called a functional MRI, you will see that portion of the brain is active. Now I close my eyes. The person is not in front of me, and I visualize that person's face with closing my eyes, and if you do a brain scan, the same area of the brain will be active. So that is the technology we are going to bring in our somatic movement. Like say from here, I'm going to do assess my subtle body and do a slowly Yog Mudra. Yog Mudra means slowly dropping my body down, but I am scanning my body slowly. There is no rush in the somatic movement. I can put my hand on my knees, or I can put my hand in the back. In a somatic movement, more and more you get a support, you're better and better. So slowly it's going to, body is coming down. And breathing effortlessly, breathing out longer than breathing in. Simply count of 2 in, count of 4 out. At least between 5 to 10 breaths, which activates my relaxation response. I also look for pain, that I don't have any pain, and I keep my spine straight. The best to do is look in front, my spine is straight, my eyes are closed. Finally, I put my hands into the back, I hold my left wrist, body is coming down, and breathing out longer than breathing in. Count of 2 in, count of 4 out, 5 to 10 breaths. Also, when you get up very slowly, one step at a time. You feel the effect of relaxation in your body and mind. Wonderful experience. The moment you activate your parasympathetic tone, it counteracts your sympathetic overdrive. Heart rate comes down, blood pressure comes down, respiratory rate starts to slow down, blood sugar comes down, muscle starts to relax. You totally control the fight and flight response, which called calm and digest. Now we look at the asanas which are really very useful for your somatic movement. Remember, the yoga therapy is holistic. Yoga therapy is not reductionist. It's not reductionist like a Western medical approach. Western medical approach is like playing a tennis game. You play one against another. Yoga therapy is like playing a football match. 10 people, they're all planning together how to win. So next asana, which will be very important for your somatic movement, will be your thunderbolt, Vajrasana. In a Vajrasana, you sit down, try to sit down on your heel. Very nice way you sit down. And when you sit down, you keep your spine straight and you relax. Like many people complains to me that it is bothering their knees, they hurt time. So I always tell them, you can always get a little pillow and put it, and you can sit down on it. At the beginning you will feel a lot better. You could use a folded blanket. A folded blanket will give you a lot more relaxation. And close your eyes. Use a mudra in your hand called Adhi Mudra. Thumb inside and close, and sit down here with your breathing out longer than breathing in, at least 5 to 10 times. If you're practicing with me, let's start. See how you feel. Breathe out first, then silently breathe in. Maybe count of 3 in, count of 6 out. Let's do 10 breaths, see how you feel. The beginning of your somatic movement. Vajrasana, thunderbolt. Then you slowly go into your Shashankasana, rabbit. But again, remember, you are going to feel the movement of your body. It's a stimulation. Many practices also chooses with a little stimulation, asana a little longer time, followed by savasana. Savasana is relaxing. But the way to do the activation of relaxation response is that your every asana will be a savasana. This is your savasana. The Vajrasana I'm doing, the effect I'm getting in my body and mind is the same as Savasana, corpse pose. So take your hand, see if you get it up slowly and slowly. There's no rush. You can do it with your eyes closed because you're going to access your subtle body. Once it goes high up, you slowly come down. You come down to the hand where you can touch the ground. You touch your elbows and slowly see if you can put your head down. You go a little bit up back. You'll be able to see me better. Slowly get your hands high up. All the way hand comes down. Elbows goes into the ground. And your head comes down into the ground. And again stay here. Breathing out longer than breathing in. Between 5 to 10 breaths. When you get up again, get up very slowly, one stepping at a time. Physiologically, you are getting the effect of savasana here. Vajrasana, thunderbolt, shashankasana, rabbit pose. Next asana for somatic movement, very important sitting down asana, will be your Vakrasana or spinal twist. And again, not only spinal twist, you'll be able to hold on to it. Slowly get into this is called a Dandasana. And very important, just 1 second, let me move the chair out from here. So I'll give you a little bit more space. And you always see, I've shown it to you, always sit down in a squatting pose, then I get up to get a support. This is inbuilt on me. Very important. This Dandasana is also very important from your somatic movement. Spine is straight, toes are a little separated. You can do a little bit of a ankle movement, very gently and paying attention to it. Another asana also very important in somatic movement is your Ustrasana, camel pose. Camel pose is also very important. But remember, holding into the pose and entering and activating relaxation response. Yoga therapy with somatic movement equals to activation of relaxation response and parasympathetic tone. Slowly bring your right foot next to your left thigh. Hold into your right knee. A little bit of hugging. Preparing yourself, the whole movement. Proprioception. Proprioception is feeling the sensation of your bones, joints and muscles. Push your right knee a little bit towards left side. Bring your left arm outside your left arm, also right knee. Hands can be like that. Right hand goes to the back. And slowly hand will come down, touch your knee. Stay in that posture with your eyes closed and visualize your whole subtle body. Slowly, you learn how to breathe out longer than breathing in, and turn your body to the right side. Come to a position where you can effortlessly take a breath. That means you can talk, you can even sing, and stay here between 5 to 10 breaths. Bring your awareness to your body and mind. Release your left hand slowly and straighten up your right. If you look at our body parameters, we have our heart rate monitor, we have our EKG, and you can take one, like I can do one EKG for myself now. Looking at a perfect EKG tracing. 30 seconds, it records my EKG. Very nice, beautiful EKG, did it? Left foot comes high up, next to your right thigh. Again, hugging, relaxing. Somatic movement of the body which your mind will appreciate. Slowly bring it down here. Now, right arm comes outside your left knee. Left hand goes to the back. Hand touching your right knee. Breathe out longer than breathing in. slowly turn your body away from you. And you stay here between 5 to 10 breaths. You will notice one thing: when you want to go a little bit further, your breath will be interrupted. Slowly come back again. Bring your body high up. Straighten up your leg. Wonderful experience. If you keep doing into this practices, holding the poses longer and longer, especially the spinal flexibility, and with a very slow movement. Again, the Savasana will come down to Savasana, will go into your deep relaxation practice. And we'll show it to you how to activate relaxation response with your supine posture and a prone posture. Supine asanas and a prone asanas. So from the thunderbolt, Vajrasana, then you get into a squatting pose. We call it a Malasana. Remember the functional entity of your body. The therapeutic effect of asanas, we have concluded by our experience and our research, is a thunderbolt, Vajrasana, this squatting pose for Malasana, and then putting your body like a stick called Dandasana. Or you call it laying on your face up, or the Jashtiyasana, body like a stick. I'll show it to you. So look at this. This one has a relaxation of your ankle, your knees, your hips, your back, your whole body is relaxed. You put your hands, separate your fingers, your hands get relaxed. Remember, when the hand is tight, nothing goes through, but when it's relaxed, finger goes through so easily. You get into Adhi Mudra very easily, like a baby. Put it there, wrist gets relaxed with extension, one elbow comes in, other elbow comes in. Slowly bring it close to you. Keep your spine straight, eyes closed, breathing out longer than breathing in. 10 breaths. Count of 3 in, count of 6 out. Easily. Count of 4 in, count of 8 out. It's a wonderful experience. From here, when you get up without a support, that is your physiological health. You are healthy. The asanas, to show the health, is a thunderbolt, Vajrasana, squatting pose, Malasana, and able to stand straight high up is called your mountain pose, Tadasana, or also you can go like keep your whole body straight high up, which will be called your Dandasana, like a stick. And with your somatic movement, you are going to feel like what you are. Here, your ear, your shoulder, your hip, and the ankle all in the same line. To test it, if you are doing it right, you can do it against the wall. I do it every single morning. I sit down in a squatting pose, drink a glass of water, then I get up, put my body against the wall like this. You'll be able to see it. So I'll go against the wall, put my heel next to the wall, slowly my hips, my shoulder, back of my head. My hands will slowly go high up. Stay here. Dandasana, like a stick. I'm here. I'm breathing out longer than breathing in. So when you are in this state of called somatic movement, when you are assessing your body and subtle body, you become like a stick. So this is like a dandasana, you're like a stick, so here I am. I was standing here, I was like a stick here. But I'm also coming here, I also feel like I'm a stick. So the whole yoga as a therapy means when your body-mind is connected, when it's called a seer becomes sin. That means what I am looking at, that's what I become. In Sanskrit and Bengali says, droshta. Droshta means person who is seeing. Becomes drishti. Drishti is sin. So the story is that there is a yogi, is moving with a stick. And he feels like he's the stick. So he comes home, subconsciously, he puts a stick on the bed and he is standing against the door as if he is hanging the walking stick in the door hook and is standing there whole night and he slept. Why? He felt like he was the stick. Seer becomes sin. From here, when you do this movement, you can do very easily. You can get your both the hands high up. But remember, when you get high up, you do it very gently and slowly. Slowly and slowly we'll go high up. Remember, this is your corpse pose, this is your savasana. Clasp your hand, put it over your head, breathe out first, take a deep breath in, and slowly get up in your tippy toes. Come down again, breathe out first, take a deep breath in, slowly get up into your tippy toes. More and more slowly you do it, more and more do with your eyes closed, more and more you feel that relaxation response. You can do side bend called Tirjaktadasana. You can do everywhere. You can do your hands high up, or you can hold your both the hands, or you can do raise your one hand high up, breathe out first, breathe in, close your eyes and slowly bend on one side, very slowly and gently, and continue your breathing. Slowly shift your body weight to your right foot. Your eyes are closed. You feel the sensation of shifting your body weight to the right. And you're staying here, breathing out longer than breathing in. Come back again, very slowly come back one step at a time. My eyes were closed and I could feel the relaxation that I was sinking more and more on the side the longer I was holding the pose. Again, try with the hand raised high up. Again, when you raise it, remember, raise it very slowly, gently, and paying attention to your hand. The normal breathing, breathing out longer than breathing in, you are shifting your body weight to the left. Most of the weight is going into your left foot. My eyes are closed. I'm breathing out longer than breathing in. You will keep on going down more and more, longer and longer you stay. Come back again very slowly, come all the way up. Kati Chakrasana is another asana, very powerful for your somatic movement. Separate your feet, your eyes are closed, your hands are in the front. Breathe out first. Take a deep breath in. Slowly move your body all the way to the back and hold into the pose and keep doing your breathing. Breathing out longer than breathing in. Slow and slow movement. More slower your movements are, coordinating with your breath, better and better will be the relaxation response. Better and better activation of the relaxation response, which will be sustaining. Remember, effect in the body, first is a change. You get a change, you get a physiological changes, which are recording through here. We're recording through our Apple Watch, which are health parameters. But the sustainable effect is due to neuroplasticity. Repeatedly doing same and keep on doing the same thing, you'll get the effect of it. So opposite side, eyes are closed, breathe out first, take a deep breath in, slowly move your body to the right side and stay in the posture. Any asana you do with your awareness to body and mind, especially the balancing asanas. So if you can do the few complete relaxing asanas with a Brahmi pranayama, that will be a wonderful asana. So let me show you a very nice technique. You can do it with your feet together. Remember, we are comfortable standing like this, so put our feet together, bring the balance. Use your hand to the back as like a prayer pose to the back. You can say it to me. I can put my both the hands together, slowly turn it like a prayer pose, and with a prayer pose, I find a spot where I feel the comfortable discomfort. Here I am, I'm very comfortable in this posture. We feel the sensation, feeling it, you get into a profound level of relaxation. Now what you can do, you can use the sound of the bumblebee and do the neck rotation and neck movement very nicely and easily, even with your eyes closed. Slowly, I breathe out first, slowly drop my neck to the back, and breathing out, I put the bumblebee breathing. pure, I don't have any pain, and my breathing is completely effortless. Next one, you can put on both the sides. You can look also to the back and rotate. Let's do a couple of more. Breathe out first. Take a deep breath in. Finally, rotate the head first to the left, back to the left. Breathe out first. Let me show you a few asanas, which is on the prone position and the supine position. Prone is the face down, supine is the face up. Hopefully you will be able to see me. Yes, that'll be good. And I can show you the somatic movement. And the somatic movement means you are able to assess the movement and able to hold it for some longer time. In yoga, more the relaxation of your body and mind, more strength is the asana. So you will see the profound relaxation response is called your Shakti asana. Shakti means your strength. So the way it goes, it puts your face down. I'm coming down slowly. Remember, everything is slow in order. Okay? So here I'm coming down. The head is down here. We go a little bit to the back. First, you put your one hand on the top is like your makarasana. Then put your head on one side. Turn your head. This time I'm turning to my right. My eyes are closed. My eyes are closed and I'm breathing out longer than breathing in. It is creating a profound relaxation response, maybe even more than even your savasana and a yoga nidra. And slowly turn your head to the opposite side, and again keep your eyes closed, breathing out longer than breathing in, and staying in this posture for a long, long time. Now, turning my face to the right, if you can see me now, I'm bringing my right hip, right angle to my body, and then my knee, right angle, like my leg is right angle to my thigh. If you look at here, my body is right angle here and is right angle here. And I'm putting my head down. This is such a relaxing asana. This is called, even called a Shakti asana. Gives you strength. You feel the touching of your knee joint, your hip joint, your ankle joint to the ground. You feel your head, your chest area, abdominal area, pelvis, all touching the ground. Eyes closed, breathing out longer than breathing in, between 5 to 10 breaths. Slowly you bring it back here. Now do the opposite side. Always do the both sides to bring the balance. Okay, left side now. Left hip became right angle to my body, and left knee is also right angle to the left thigh. Left thigh and left leg is in right angle. Now slowly turn around, right side or left side, either side, and get into your supine position. In a supine position, what you need to do, you have to be sure. In a supine position, you need to be sure that your body is straight, your chin is below your forehead. You don't want to be like this. So the chin is high up. It is called sympathetic. So chin is down, hands are on both sides. Bring your awareness to your body. That is your somatic movement. You feel your head, back of your head is connected to the ground, back of your chest area connected to the ground, back of your hip connected to the ground, back of your thigh and the ankle connected to the ground. But if you look at me, you will see there is a space under your lumbar area. See, my hand is going there. This lumbar area is little arched, that means tight. That is your awareness. Let's bring this practice with your breathing. You'll see the breathing in, first lumbar area is going to go high up a little bit. And breathing out, area is coming in. See, there is no more space. So breathing out, whole lumbar area will drop down, and breathing in, the lumbar area will go high up. Let's try a couple of more times, and also your feet are together, and try another one. This is called your Jashti Asana, like a stick. Get your hands all the way high up in the ground. Now do your breathing and drop your lumbar area down with the exhalation and lumbar area up with inhalation. You know, you cannot even count when you are in this state because your mind, body is completely relaxed. In fact, I always tell, if you know how to count, you are not doing yoga. I'm so relaxed, in fact, to bring my hands up, I'm slowly supporting my hands and bring it up and slowly putting it down on my side. My hands, palm facing high up, about 6 inches from my body. Feet are a little bit relaxed, and now about a width of your mat. Now we can see I'm relaxed enough that there is no space in between my lumbar area. So now my whole body, back of my head, back of my chest, my lumbar area, hip area, thigh, knees and ankle, all in the same line. Gestation, or even the beginning of Savasana or Yoga Nidra. Bring your awareness to abdominal breathing. Abdominal breathing is a relaxation. I hope you can see me well. Yes, you can see me. This is your abdominal breathing. In abdominal breathing, you bring the somatic movement, you bring the relaxation. It's like your baby. Like if you see a baby, baby will do a breathing like when you breathe in, your abdominal wall will rise. Breathe out, abdominal wall will go in. We have two kinds of breathing, thoracic breathing and abdominal breathing. Thoracic breathing brings us your increase in the chest breathing, improve in the lung function, but abdominal breathing is purely parasympathetic activation and relaxation response. Let's do it about, again, 5 to 10 times. And feel the effect of it. I'm feeling a profound level of relaxation. You can also take the advantage of breath holding. The breath holding in inhalation is called Abhantarin Kumbha, is the activation of the vagus nerve. The phenomena is called Herring-Brewer reflex. When you hold your breath, the lung starts to expand, and when it really expands, then the vagal activation comes in, it starts lungs not to expand anymore. Let's do a breath holding. You can do a very simple breath holding, say count of 5 in and count of 20 hold 4 times, and then breathe out about 10. Or you can start lower with a count of 4 in, 16 hold, 8 out. When you progress to 5, 6, 7, I can do count of 10 in, 40 hold, 20 out. So breathe out first, breathe in, count of 4 in. Hold your breath, count of 16. Breathe out with a count of 8 out. Breathe in with a count of 5 in. Hold your breath, count of 20. Breathe out with the count of 10 out. Breathe in with the count of 6 in. Hold the breath for count of 24. Breathe out at the count of 12. You can also do a simple chest breath holding in and out. Like I say, I'll do a count of 5 in, count to 20 hold. I'll do it about 5 times. You'll bring in a profound relaxation in the body and mind. This will be like this. Breathe out first. Breathe in with a count of 5 in. Hold the breath for 20. Same ratio about 5 or 10 more times. Hold for 20. It's a wonderful practice. Let's look at the profound relaxation. How do you bring a deep relaxation in your supine savasana? First, your eyes are closed. You started scanning your body, and consciously you are relaxing your toes. Consciously relaxing your feet. Your ankle joint is relaxed. Your cuff muscles are relaxed. Knee joints are relaxed. The thigh is relaxed. Hip joints are relaxed. Gluteal area, pelvic area is relaxed. Continuing your breathing with the same ratio of breathing out longer than breathing in. Here you incorporate your pranayama. You are in an asana pose, savasana. Pranayama, voluntary regulated breathing. We'll do a pranabho pranayam, a, u, ma. What part of the body we'll do with the a? If you're practicing with me, let's practice. Breathe out first. Take a deep breath in. Bring your awareness to the middle part of the body. Relax your abdomen. Relax your umbilical area. Be sure your umbilical is centered. For men, it is very easy. You can take a thread, measure from belly button to the nipple line. Both sides will be equal. You are properly relaxed. You are healthy. In the women, they can do from belly button to the collarbone, middle part of the collarbone. It should be equidistance. Or you can do from belly button to the tip of your great toe. If belly button is not centered, we have asanas called your belly button centering asanas, 5 asanas. Another way to diagnose is if you put your finger at the belly button, push it down, you will be able to feel a pulsation. It's called aortic pulsation. If your belly button is not centered, you won't be feeling that pulsation. I can feel the pulsation very clearly. Bring your awareness to your diaphragm. Relax your diaphragm. Bring your awareness to your chest. Relax your chest. Now you bring the pranayama to U, middle part of the body. Breathe out first. Take a deep breath in. Oh. Bring your awareness to shoulder. Relax your shoulder. Bring your awareness to your neck. Relax the neck muscles. Relax your face. Facial muscles are all connected through your skin. All the frowning, all the lines in between your eyebrows, on your face, all slowly and slowly goes away. When the muscles are relaxed, the skin doesn't get tense, you don't see your lines anymore. You don't need a Botox. This is your Botox. Relax your eyes. Relax your upper arm. Relax your hands. Relax your fingers. When hands and fingers are relaxed, both the hand drops in the ground like this. Otherwise, the finger goes high up. Let it be. It will come to you. It will come to you. Don't push it. Upper part of the body, pranayama is ma, pranabho pranayama. Breathe out first. Deep breath in. Do a little pumping and cupping will also help. Rub your hands. When you feel the warmth in your hand. If you want the glasses, remove your glasses. Put your hands over the eyes like a cup. Let the eyes take all the heat. Massage your forehead. Massage your eyes. Massage your ears, back of your ears, front of your ears, the tragus, external canal. Massage your face, bring your hands to the neck, massage your carotid sinus in the back, and again go back to your deep relaxation. Enter into the fifth limb, pratyahara. Learn how to control your five senses. Eyes are closed. Learn how to shut down your hearing. Shut down your smell and taste and touch. It's like a turtle taking the head inside the shell. Slowly bring your awareness to your breath. Breath is your focus, dharan. Visualize your breath. Visualize your breath coming in through your nose. It's getting filtered, it's getting air conditioned, going to the side, back of your throat. Coming to the upper part of the lung, middle part of the lung, lower part of the lung, almost level to the belly button. When you keep on visualizing the breath with the dharan, the focus, the sixth limb, you develop a pause in your breathing at the belly button. Sanskrit is called Kebal Kumbhak. Visualize your breath coming in, lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through your nostril. Breath is picking up your prana. Prana stays outside your nostril. Visualize prana is coming to your breath. In yogic tradition, your whole body does the breathing. Visualize prana is coming to the organ of healing. Here the organ of healing for me is my heart. Visualizing prana is coming to my heart. If a back problem, visualize prana is coming to your back. Diabetes, visualize prana is coming to your pancreas. When you keep your focus on, slowly and slowly get defocused. Enter into meditation. In meditation, your mind quiets down. Meditation is medication. Normally we have thousands and thousands of thought processes in our mind. Majority of the thought processes are in the past. A big portion is in the future. Very few thought processes in the present. Yogic tradition will live in present. Even in the present, we have thought process, which is a repeat thought process. Chattering of your mind, chitta vritti. In a state of meditation, you enter in between the thought process, which is called a gap. Slowly and slowly the gap expands. You still have your thought process, but you still don't have any chattering. The thought process doesn't come back. Chitta vritti nirodha, controlling the chattering of your mind. Staying calm in the middle of crisis is your meditation. Once you practice, the neuroplasticity sets in. You stay in meditation for 24/7. Finally, you enter into the eighth limb called Samadhi, which is the union of your body, mind and spirit. Enjoy this relaxation response, effect of it in your body and mind. Slowly bring your awareness to your toes, move your feet, move your ankle, move your knees, hips, your hands, fingers, bodies. You bring back at the present. Slowly turn your body to the left side. Very important yogic technique. Put your head on your folded hands. Bring your feet like a fetal position. Give some time to balance your body. Laying in the left side, your right nostril opens up. You had a relaxation response, cooling of your body and mind. Right nostril breathing will warm you up. And also on the left side, the right side, we have inferior vena cava, and you will have a better venous return. We call it better preload. And then relaxation, you have a reduction in the afterload. You have a good cardiac function. Then you slowly get up, straighten up your right leg, put your hand in a support, and slowly get up and sit down, your comfortable cross-legged position. Wonderful practice, yoga therapy with somatic movement. activation of the relaxation response, parasympathetic tone, counteracting sympathetic tone of our stress, counteracting the effect of cortisol in our body, and bringing yoga as a treatment for lifestyle related disorder. Yoga is a lifestyle medicine. Thank you for joining. We'll be here every Saturday, and this is the class. We've been doing it for years and years, for a long time, through Satic Space, Yoga and Healing Studio. Thank you, Satic Space. Please, you can go to their Facebook Live site and contribute them in this time of COVID-19. Thank you for joining. We'll see you again next Saturday.